So you're on strike and your child is not well.
But actually, I'm not part of the striking team.
Oh, no, you're
I'm
not.
from UPA.
Oh,
Okay, there are
So we
those
are not
who are
part
not.
you are
of
the
the
people
striking team.
who
But
disagree
remember,
with.
so I'm not seeing
I
them.
I
said
said you are the people who disagree with the
yes,
strike.
yes. Unfortunately, my child had been sick for a while.
But we've not been
And
seeing your members around.
they do come, as we are here, they do come once in a while. But actually, the region here in regional hospital, we are not many here.
You are not.
I did been like places like War Memorial, where we have few
Yeah,
of them.
one memorial. I think the
Not from
members.
So how many are you
up
in
to eight.
this place?
This place,
As mobily at the region.
staff here.
Oh, you're right, staff.
I'm coming on referral from Wedam Medical Center.
Oh, when that.
Wedam.
Oh, when that.
Private
Wedam.
facility in Nigeria.
So I'm coming from that facility. My child was actually
Yeah.
a very bad shape. So
Yeah, that's
we
what he
referred
said.
us.
He decided to come. Okay.
Our doctor has been trying.
So, thank you very much. Those of you who understand. So, when you talk to your colleagues, life is precious.
It's true.
So you yourself, if it were, you go to the hospital where there's nobody. It's not fun.
It's true, it's true. It hasn't been easy, even though me in the profession, I know, like being sick and going to the same facility you work and still pay for your bills, it hurts.
Yes.
But for me as a person, not because I'm a mother in this situation, but I was thinking maybe the government could have also understood us and to go about it in a different way
Yeah.
than we striking and the government also leaving us to strike for long. It's like a two-way kind of thing. But I think we should all come to like an agreement and the nurses will come back. Because yesterday I thought I was going to lose my child. Other patient relatives have to help the doctor, has to call for other doctors
Yeah.
to come here alone. It hasn't been easy for him, I must admit. I saw the way he struggled to bring my child back.
That's
At the time, my child was bleeding from the nose, hallucinating. I wept.
Yeah.
I broke down at some point. I realized the work has not actually been easy.
Yes.
But we still say thank you to our doctors who are also the supporting team.
That's right.
But then the government should also understand us and
Yeah,
try
exactly.
to.
Exactly. So the government has put a very simple message. The government says that they do not disagree with you. What they are saying is that there's a budget. Government doesn't spend like you've gone to your room, fetch granules and chop.
Yes.
So government spend based on budget.
Yes.
And so we all saw how Ghana was treated. And so if we allow government to spend beyond what they have budgeted for, then it means that we're sending Ghana back to where we were. So they were pleading with you that okay, just exercise patience. We are the next budget. We factor everything in, but we'll throw this one off gear, and Ghana will suffer, and you are going to be part of it. Even if they give you the money, more than what you have now, and then the depreciation takes it off, or the CD to dollar continue rising. It makes your money so also ineffective, or it can't have the full value. So that's what government is saying. Government is not saying that you have no right and that you do not deserve it, but you need to give us space. So and it should have started early enough for us to put it in the budget. But once, and so that we would have cut up some other areas and put yours there. And so that we
The
don't run
government
there.
should try to meet us halfway.
Oh, no.
So now look at in this situation.
The government should meet
No,
us
in this
halfway.
situation, being a nurse and seeing the situation you found yourself and your child, what message do you have for your colleagues?
I'll actually beg them, since from day one we say we are working with passion and we should let that passion lead us, even though the system has not really been easy. The system has not truly been easy. Most times I take my salary and I look at it and I look at the bills and other things. It can't do anything for us, or it can't do anything for me and my family. But since we are driven by the passion and not actually by the money itself, we know even though in life, if you don't have money, you suffer most. We should let that passion still lead us and go around it in a different direction, because a lot of people are dying, not because I found myself in this situation, but what of those who have not had the opportunity to come here? What of those who did not even step in the health sector because nurses are on strike and they wail in pain and maybe gave up in life. They should let that passion still drive us to come back to work, no matter what. No matter what, the passion is what has driven most of us into the profession. And since we are in it and we chose to be in it, we should let that passion lead us and come back. We always say we've chosen the work because we want to do it. We want to help and alleviate pain. But now we are those rather causing more pain. We should come back and let the government handle things, and we all dialogue around the whole situation and come back. We shouldn't let anger and compare ourselves with other professions driven us to do what we were not supposed to do. May I plead on behalf of the general public that we plead on the nurses. We should let the same passion that driven us to go to the training, come back to the work. We know the system is very hard. It's very hard, but still, we should temper mercy, we should temper justice with mercy and come back to it. Because we are losing a lot of souls. And most of us
Because now
are
let me
our
say,
own people.
assuming, God forbid, you had lost your child and tomorrow the government had doubled whatever money you get. I don't know whether
I wouldn't have forgiven myself, and I'm not sure I would have had the passion to carry on with the work. Because this is my only child. What then happens to me when I amass the whole world and lose the most important thing to me? What happens? Because it was shocking when I called my colleagues the same place just to attend to my child, and they are like, oh, you come, we'll consider you, but then we are on strike. So, but one or two nurses cannot do it all alone. If I hadn't gone to weather my cry on him to refer me, I wanted to actually go to like my own facility. But then because of the striking, I couldn't go. I went to a private center. They couldn't handle her. They said I should come here. Had it not been because Dr. Wedam had mercy on me and listened to my cry, contacted a pediatrician and arranged for me to come here, by now I wouldn't have been here talking.